Dr. Ralph Abraham, Louisiana Surgeon General, will serve as the agency's principal deputy director. A spokesperson for the Department of Health and Human Services confirmed the appointment to NBC News, though it hadn't been made public as of Tuesday afternoon. Earlier this year, Abraham instructed Louisiana's health department to stop promoting mass vaccination. He wrote that patients should discuss shots with their doctors, but that the state would no longer encourage widespread vaccine campaigns. The internal memo dated February 13 was the same day Robert F. Kennedy Jr. was sworn in as HHS secretary.
Shaking my head again. We're shaking our heads again. Right?
I mean, bad already.
Exactly. So hello, I'm Dr. Haydee Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. So we have some more big changes this week at the CDC. And here's where we are, people. So Louisiana health officials who literally, this guy told his own department to stop promoting mass vaccinations in the middle of a major flu surge, is now stepping into the number 2 leadership role at the CDC. So yeah, the same person who pulled back vaccines messaging during an outbreak will now help run the nation's top public health agency. Ralph Abraham, Louisiana's Surgeon General, currently he has stepped down. He just was hired as the CDC's principal deputy director. He is already listed as this internal directory, but through his CDC emails doesn't even work yet. He is now the symbol of the moment we're in currently. And remember, the CDC doesn't have a current permanent director. So Abraham is essentially the person that is steering the ship. I mean, I think it's run amok, but nonetheless. So why? Because this is so important after Secretary Robert F. K. Jr. removed the previous CDC director, remember, Susan Monrez, after she refused to sign off on vaccine recommendations he wanted to push through. So then he fired every federal vaccine advisor at the CDC and replaced them with critics of the COVID vaccine and other routine immunizations, MMR, pertussis, whooping coughs, that kind of stuff. Those things that are now hitting the United States hard. Abraham's arrival, though, is just the latest step in this pattern, this placing vaccine skepticism above policy. And so here's the headline that everyone needs to know. At the time when our country needs clear, science-based public health leadership, the CDC is being shaped. It's being reshaped, I should say, by people who don't even believe in the tools that are going to save lives, you guys. So this matters because who leads the CDC also influences not just the technical guidance, but also public trust, the messaging that goes out, and ultimately how we as a nation are going to respond to disease outbreaks, vaccination campaigns, and long-term public health strategy. So Dr. Brown, this, I think, is a moment that we need to unpack about this appointment. I mean, he is an MD. We want to talk about some of the potential benefits maybe of him, but also the big red flags that I think you and I can really lend a lens to. What are your thoughts?
So, let's be fair and let's walk through what some folks might consider potential upsides, right? Or at least what proponents of Dr. Abraham's approach are arguing. Some people are calling him a fresh voice with a so-called medical freedom lens. And they say he wants to put doctor-patient choice first instead of relying on big sweeping mandates, right? Those are scary words. And yes, for families who already feel disconnected from public health messaging, an emphasis on individualized decision-making might feel reassuring. And if it were done responsibly, that could actually help rebuild the trust between patients and their physicians. But instead of everything coming, top down, right? But there's also talk about reevaluating the old one-size-fits-all public health playbook. Under his leadership, they might scrutinize broad vaccine campaigns and shift towards more targeted strategies. So, focusing resources where risk is the highest instead of casting the widest net. And for communities that have felt ignored or overly policed by public health, that shift could sound like a more respectful approach. And in theory, a leader who says he's willing to challenge established narratives could open space for scientific debate, space to re-examine assumptions and demand more transparency and call out pharmaceutical influence when it's warranted. But if that process is rigorous and if it's grounded in evidence and fully transparent, it could actually strengthen the trust among folks who have been asking for honesty for a very long time. And, let's again speak the truth. In communities of color, where medical mistrust is rooted in lived experience, not imagination, anything that genuinely empowers individual agency can resonate. The idea of having a real say, a real voice in your health decisions, that hits differently for us. But all of this only works if it's rooted in good science, not good spin. And if these ideas are communicated, humility, respect, and cultural competence, not ideology. So, that's the optimistic read. But Dr. Sloan, what should we actually be worried about? What are those red flags?
I think it's hilarious that the red flags are going off as those sirens behind you in New York City. I mean, is that not metaphysical somehow about the danger signs and why many public health experts should be alarmed? So I'm going to play the bad guy today, devil's advocate, whatever you want to call it. But Abraham's past record shows a pattern of vaccine skepticism and public health caution that deviates from evidence-based consensus. And as the Louisiana prior Surgeon General, he did halt these mass vaccination promotions, including flu shots and COVID-19 outreach, and even pushed a model of personal choice over population level public health measures, says the Washington Post. Let's show this actual screenshot of the Louisiana Department of Health. And this was in February 13th, right before RFK Jr. became the new CDC head. And so, Secretary, it's restoring the trust in public health starts with restoring trust in medicine. I think it's pretty comical and how he went along to just single-handedly cause this mass vaccination campaign to be halted. That raises big red flags for me. And then this rolling effort to stop all of this threatens years of progress and research that we keep talking about, right? So the other big red flag is he has had previous missteps under his leadership coinciding with the outbreak and delayed response in Louisiana. So during his tenure, the public health observers noted that his department was always delayed in notifying physicians and the public, specifically with the whooping cough or pertussis outbreak, and the worst of all in any states right now, says Democracy Now! Media. So what kind of delay and downplay can allow preventable diseases to spread, especially when there's a huge community of minorities in Louisiana. So those are the vulnerable communities, right? So potential other thing that's a red flag is the resurgence, not just of preventable diseases that we have fought years to suppress, like measles, but given the recent history in the United States and globally, with the vaccine rate declining, particularly in childhood diseases, he has definitely been hands-on when it comes to the response in Louisiana of shutting down vaccines. The shift in the CDC leadership under this vaccine skeptical influence creates big risk for more outbreaks, especially among kids and immunocompromised and communities at low access to healthcare, pretty much all of Louisiana and a lot of minorities. So the other red flag is the erosion of public trust and undermining science-based policy. If you throw out all of the scientists, who's there to support this? And he's a doctor, but under RFK Jr.'s stewardship, the CDC recently changed all the wording. Remember, we talked about this, autism and vaccine page, removing its standing statement. So how is he going to play into all of this? If he now is appointed, may he also lead the Americans to question whether public health guidance is driven by ideology and not data, science, research. So once trust is eroded, red flag, then there's going to be even accurate life-saving guidances are going to be suspicious. Anything that comes out now, people are, have a side eye of trying to figure out what's right and wrong. And then another red flag, instability in our big institutions, loss of expertise. Your researchers, your NIH, your CDC scientists that are gone. Remember, they resigned over this politicization of vaccine science and dismantling advisory board. That was months ago. So here we are in such of a climate that policy guidance risks becoming inconsistent, reactive, and poorly informed, with the long-term consequences of disease prevention and outbreak response. Where are we going with this, you guys? Particularly the high risk who are underserved and marginalized population. That again is minorities and low income communities suffering disproportionately from outbreaks. Hell, they just got their SNAP benefits back. And so now we're going to start limiting care and causing more distrust and more system inequities. And so under this weakened vaccine advocacy and public health infrastructure, those disparities are going to widen, I promise you. So Dr. Brown, when the government and the governing bodies like the CDC are supposed to protect us at a time when these outbreaks are taking place all over the world, things that can actually kill us like COVID, that's a huge red flag. Case in point, let's roll this clip.
People are paying attention because we're seeing cases earlier and we're seeing more cases in places, as you mentioned, across the world, with subclade K now being identified in Japan, Canada, and the UK. It's still unclear about what this might actually do to the US, but this is definitely why the global surveillance influenza system, yes, that exists, is on high alert.
High alert.
High alert. So, let's get into what this actually means for the health of our nation. Because with a new flu strain while this new flu strain is already circulating around the globe, the CDC's own webpage is silent. So in this segment too, nothing, nada, nothing. There is a silence there, and that silence is loud. And so here's what we're looking at in the months and years ahead. First, we could see the return of outbreaks we already beat back. So if vaccination rates dip, if campaigns lose funding, if the public gets mixed messaging, we're going to see clusters of measles, pertussis, flu, diseases we had under control. And as a surgeon and as a mom, I cannot overstate how dangerous that is. Second, confusion becomes crisis. When people hear one message one week and another message the next, medical freedom here, followed signs there, folks check out, right? They're going to tune it all out. And when the public doesn't trust guidance, herd immunity drops, community protection weakens, and misinformation fills those gaps. And third, health disparities widen. Who gets hurt first? The same communities that always get hurt first. Black and brown communities, rural communities, immigrant communities, poor communities. Anywhere access to health is limited and trust has already been broken. And a weakened public health response doesn't hit everyone equally. It hits the vulnerable hardest and fastest. Again, if you have the money to pay for your vaccines that are no longer covered by insurance, you're protected. But the rest of the folks are not. And fourth, we risk rolling back decades of progress, decades. Everything from routine childhood immunizations to flu prevention programs, even things like water fluoridation, which, by the way, Dr. Abraham opposed in Louisiana. Those could be dialed back and defunded. And that's not just a policy shift. That's dismantling the very infrastructure that keeps communities safe. It's actually, to be frank, why people even think they could have these discussions, right? Because these diseases and these problems don't exist anymore. And finally, the biggest danger of them all, when scientific institutions lose their credibility, it takes years, sometimes generations to rebuild. So if the CDC becomes seen as political instead of data-driven, how does the nation approach the next pandemic? How do you convince the public to listen when it matters? And this is the bottom line. Herd immunity isn't some abstract public health slogan. It's math, it's science, and it's the thin line that keeps deadly diseases from roaring back. For most vaccine preventable illnesses, once vaccination levels drop below 90 to 95%, we lose that community shield. That's the break point. Below that, viruses see an opening and they take it. And we start to see exactly what public health experts have been worrying about: clusters, outbreaks, and preventable suffering. And let me remind folks, that is not theoretical, right? In this lifetime, polio is not just a history book disease. It's a virus that paralyzes children. It's a disease that leaves people unable to walk, unable to breathe without machines. Go talk to any elder in your family, and they may remember these leg braces, iron lungs, where literally a person is in a machine as an iron lung for the rest of their life. Children who went to sleep healthy and they wake up and they're not able to move. And that's what happens when herd immunity breaks. And measles, one of the most contagious viruses on the planet, If vaccination rates in a community drop even slightly below that 95% threshold, measles spreads like wildfire, especially among infants, pregnant women, immunocompromised people who can't get vaccinated, like those that are getting cancer treatments. Even if they wanted to, they rely on us to protect them. So when vaccination rates slip, even by a few percentage points, we're not just flirting with danger. We are turning the lights off of a system that has kept generations of children alive and healthy. And that's the real conversation. That's what's at stake. Dr. Sloan, what's your take on all of this? I'm feeling pretty grim.
I know. I always want us to leave and close on something that's positive. So I want to be hopeful, but yeah, we live in reality, right? And we get it. The CDC is not sitting well, this whole new appointment, right? And we believe, though, at MeidasTouch in power of agency and community, and even individuals being informed and stepping up. So I want you to demand transparency, advocate for, locally for your clinics, your school-based immunization programs and outreach programs for the underserved, but stay informed and be empowered of your own responsibility, your own community consciousness on your vaccines that really do matter, because good health is neither a privilege nor a political point. You guys, it's a given right.
So my call to action to all of you all is do not wait. Use your voice, use your platform, teach, inform, empower, encourage trust, but always encourage healthy skepticism, critical thinking, and accountability, because public health has never flowed only from Washington. It comes from people like you. So we need you to stay vigilant and stay informed. What would you say, Dr. Sloan?
Stay loud, stay responsible, and as always, we want you to stay healthy and alive. So we're AYA, contributors of MeidasTouch Network, and we are proud members of the Meidas Mighty. Please subscribe, like, share, comment, and updates. We want you to go to YouTube and MeidasTouch Networks or AYA's Substack. Have a great week.
Bye, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.